Top 3 vitamins every diabetic should take. Lower blood sugar. If you feel tired from tracking every single carbohydrate, juggling your medications, and never quite getting your blood sugar under control, you're not alone. Many people dealing with diabetes believe they have tried every trick in the book, reducing certain foods, testing their glucose levels, and taking all sorts of prescription drugs, yet still struggle with fatigue, body aches, and unpredictable sugar spikes. Here's something that might surprise you. There are 3 vitamins that often go unnoticed, but can play a big part in helping your body handle insulin, boost your energy, and protect your nerves from harm. You might be thinking, this sounds like yet another quick fix. The truth is, these vitamins are backed by common sense and scientific understanding, which makes them worth your attention. By the end of this script, you will know which vitamins can help make your diabetes management more effective, why they matter so much, and how you can start adding them to your daily routine without turning your life upside down. If you're ready to stop feeling stuck and learn something that might give you a better shot at steadier blood sugar, keep reading. 1. Vitamin D, more than just sunlight, support. When people hear about vitamin D, they often connect it with strong bones or a better immune response. If you have diabetes, though, vitamin D holds even greater importance. It does more than help your bones absorb calcium. It also takes part in supporting your body's insulin response, keeping certain internal reactions in check, and helping your nerves stay healthy. But why are people with diabetes more likely to run low on this vitamin? One reason is that insulin resistance and ongoing swelling in the body can affect how vitamin D is used. High blood sugar paired with frequent urination causes the body to lose vitamin D more quickly. On top of that, many people spend a lot of time indoors, reducing their exposure to sunlight, the main natural source of vitamin D. With age, the pancreas and liver also lose some ability to convert it into its working form. If you add all these factors together, it becomes clear why people with diabetes tend to fall short on this nutrient. A lack of vitamin D can show up in different ways. You might feel tired most days or notice your muscles seem weak when you do simple tasks. Wounds might heal slower than usual, and numbness or frequent infections could become more common. Some people also experience sugar cravings or mood swings that connect to low vitamin D. As levels drop further, it can set off bigger issues. For instance, men might face lower testosterone, and women might have more difficulty ovulating. Nerve-related symptoms like tingling or slower reflexes can get worse, while kidney stones might appear more often because vitamin D helps the body manage calcium. There is also a higher chance of eye complications, such as changes in the blood vessels of the retina. Heart problems become more likely as well, since poor vitamin D status is tied to higher blood pressure and more plaque in arteries. Inside the cells, this vitamin plays a key role in assisting pancreatic beta cells, which make insulin, and it helps reduce harmful swelling in the body. The best natural source is the sun itself. Spending time outdoors can help your skin produce vitamin D, but not everyone can or wants to spend much time outside. For food sources, look for salmon, sardines, and egg yolks. Cod liver oil is also known for having a lot of vitamin D, though some people find it unpleasant to taste. If you like mushrooms, you can look for varieties grown under ultraviolet light, as these contain more of the vitamin. For a more upscale meal, miso-glazed salmon or seared cod liver offer both flavor and a boost in vitamin D intake. Still, many people discover they need a supplement to get enough. Nordic Naturals Vitamin D3 or Thorne Research. Vitamin D plus K2 are popular brands, but there are many options on the market. It may be wise to look for a product that also includes vitamin K2, since that nutrient helps direct calcium to the places it belongs. If you do decide to take a supplement, consider speaking with a healthcare professional who is familiar with your medical history. Several habits and foods make it harder for your body to hold on to vitamin D. Processed oils can promote swelling inside the body, which reduces how well vitamin D works. Eating a lot of sugary items and refined grains can also deplete magnesium, and the body needs magnesium to make vitamin D active. Drinking too much alcohol harms the liver, the organ that changes vitamin D into a form your body can use. Whole grains high in phytates may reduce absorption of some minerals, which also affects how your body manages this important vitamin. By keeping a closer eye on what you eat, you give yourself a better chance of maintaining healthy vitamin D levels. 2. Vitamin B12. Overlooked yet important vitamin B12 is often overshadowed by more familiar nutrients, but it plays a large part in how your body creates energy, maintains healthy nerves, and builds red blood cells. People with diabetes often have a bigger risk of being low in B12, especially if they take metformin. This common drug helps control blood sugar, but over time it can interfere with the body's ability to absorb B12 from food. High blood sugar can also damage the stomach lining, making it even tougher to get enough B12. As a person ages, the stomach produces less acid, and acid is needed to break B12 away from proteins in the foods you eat. Because of these issues, many people with diabetes can develop B12 shortages without realizing it. A B12 shortage usually does not happen overnight. It often creeps in so gradually that many people think it's just part of getting older or the normal effects of diabetes. One early clue is a tingling or numb feeling in the hands and feet, which often ties in with nerve damage. You could also feel extreme fatigue, get dizzy spells, or have shortness of breath, because B12 is central to building red blood cells. Another clue might be brain fog, memory problems, or feeling disorganized, which some folks chalk up to aging. In truth, these signals might be your body telling you it needs more B12. If low B12 continues, other parts of your health can suffer. For instance, men might see a drop in sperm quality or reduced testosterone, while women can face issues with ovulation or higher pregnancy loss rates. Poor nerve function may worsen if there is not enough B12 to repair and protect these delicate cells. High homocysteine levels can arise when B12 is lacking, which can harm blood vessels and increase the risk of kidney problems. Long-term damage to the optic nerve may also occur in extreme cases, leading to vision problems. These outcomes highlight how B12 is central to many processes in the body, from heart health to proper brain function. B12 mostly comes from animal-based foods, since plants do not have this nutrient in a natural form. Top choices include beef liver, clams, sardines, salmon, and eggs. If you enjoy more adventurous meals, foie gras or sea urchin may give a major bump in B12, but those are not in everyone's meal plan. If you already suspect a low B12 level, taking a supplement might be more reliable. Methylcobalamin is often considered easier for the body to absorb. Gero Formula's Methyl B12 and Thorne Research Methylcobalamin are two examples of brands people trust, though there are many others. If you take a supplement, read the label and possibly talk to a doctor or dietitian to make sure you are choosing a form that works well with your body. Just like with vitamin D, certain habits can make a B12 shortage worse. Alcohol can harm the stomach lining and liver, both of which matter for B12 use. Refined grains, white bread, white pasta, and sugary snacks can raise general swelling, which may interfere with absorption and increase the rate at which vitamins are used. Medications that reduce stomach acid, such as proton pump inhibitors, also make it harder to free up B12 from proteins in food. By being aware of these factors, you stand a better chance of holding on to any B12 you do consume. 3. Folate, vitamin B9. The helper for cell building, folate, sometimes called vitamin B9, is often overshadowed by other vitamins. Yet it is a big helper in cell building, red blood cell creation, and healthy DNA. Your body cannot store a lot of folate, so it needs a steady supply, and people with diabetes often find themselves lacking. This is because high blood sugar can set off unhelpful reactions, making it more challenging for the body to handle folate. Metformin also blocks some folate uptake in the intestines. On top of that, the frequent urination linked with diabetes means water-soluble vitamins like folate wash out more easily. A lack of folate can sneak up on you in ways that resemble normal diabetes symptoms. Feeling more tired than usual, having cuts that take a long time to heal, or dealing with brain fog. When folate levels become too low, you might notice anemia, which brings its own signs like pale skin, dizziness, or shortness of breath. Many people assume these problems come from diabetes itself, but not enough folate may be a key factor. Folate also plays a part in preventing higher levels of homocysteine, a substance that can damage blood vessels and strain the kidneys over time. Men can see issues with sperm, while women may notice hormone imbalances that can complicate pregnancy. Having too little folate can also intensify nerve problems, since the vitamin is important for making chemicals that nerves need to function well. If you have already felt tingling or numbness, a folate shortage might make it worse. Over a long period, poor folate levels can change how well your body maintains healthy cells and repairs damage. Since diabetes already challenges your system, not having enough folate only makes things tougher. Aim to add foods like beef liver, spinach, lentils, asparagus, and avocados to your meals. If you'd like something fancier, duck liver pate or a risotto made with spinach and asparagus might offer a big serving of folate while also giving a more interesting taste. If you suspect your folate level is very low, perhaps after years of taking metformin, you may benefit from a supplement. The best type to look for is methylfolate, which you'll sometimes see on labels as 5-MTHF. Thorne Research 5-MTHF and Pure Encapsulations folate are often mentioned as reliable picks, but there are other options too. The main thing is to make sure you are choosing a form your body can use well. Certain foods and drinks can speed up folate loss. White bread, white rice, and other refined grains lack the natural folate found in whole forms, so they do not help your intake. Alcohol disrupts how the body handles folate, while very sugary foods put extra stress on your system. Some medications, like antacids, also block folate. By being mindful of these, you can hold on to more of the folate you eat and make it easier to stay balanced. Diabetes can be tough, and many people feel stuck because they have done everything their doctor told them. Avoiding certain foods, monitoring sugar levels all day, and taking medication, yet still struggle with fatigue or nerve pain. Adding these 3 vitamins into your plan may help. Vitamin D works like a boost for your insulin and helps keep many of the body's processes working well. Vitamin B12 is a strong ally in the fight against nerve damage, low energy, and other body-wide problems. Folate helps your cells grow and divide in a healthy way and supports the repair work your body constantly does. Of course, vitamins are not magic bullets. They are part of a balanced routine that usually includes a good meal plan, some kind of movement or exercise, enough rest, and regular checkups with healthcare providers. They can, however, plug gaps that many people with diabetes have. If you ignore these vitamins, you might end up feeling more tired or in more pain than necessary. Addressing them can make your day-to-day life a bit easier. Get tested. If you think you might be low in vitamin D, vitamin B12, or folate, ask your doctor for a blood test. Knowing your exact levels can help you figure out how much you need to increase through food or supplements. Read labels and research brands. If you decide to buy supplements, do a bit of reading on which brands are good quality. You can look for third-party testing or certifications to ensure you are getting what the label claims. Combine healthy eating with supplements. Whole foods are more than just vitamins. They have proteins, fiber, and other helpful nutrients. So even if you take supplements, try to make sure you eat a balanced mix of proteins, healthy fats, and carbs with plenty of fiber. Limit foods that harm. Processed oils, sugary snacks, and refined grains do not help, and they can make it harder for your body to stay balanced. Keep an eye on your intake of these items. You do not have to cut them out 100% unless your doctor advises it, but lowering how often you eat them can make a big difference. Pay attention to physical activity and rest. Getting enough movement each day helps with insulin response, and proper rest allows your body to repair itself. Vitamins and nutrients work best when your whole body is in better shape. Stay in contact with healthcare providers. If you have diabetes, regular checkups matter. Your doctor or nurse can track changes in your blood sugar and adjust medications or give advice as you improve your routine. It's easy to look for the next miracle pill or quick fix, but diabetes often requires long-term changes that become part of daily life. Paying more attention to vitamin D, vitamin B12, and folate can be one part of a bigger plan that involves being cautious with sugary foods, adding more vegetables, and finding ways to manage stress. Small changes can add up over time, and making sure you get enough of these 3 vitamins might be the missing link in your program. For some people, these nutrients might help level out erratic blood sugar levels. Others might notice more energy to get through the day. Some might find that their nerves do not feel quite as irritated. Everyone's experience will differ, but none of these vitamins are harmful when used properly, and many studies suggest that they offer benefits for people who are dealing with diabetes-related challenges. At the same time, remember that getting too high a dose of any vitamin can sometimes cause problems, so be mindful of recommended ranges. Always let your doctor know what supplements you take, especially if you are on medications that might interact with them. Vitamin K2, for instance, can interact with certain blood thinners, so it's smart to keep your doctor informed. This expanded look at vitamin D, vitamin B12, and folate is designed to give you a stronger sense of how these nutrients may help you manage diabetes in a more complete way. They can work together with your eating plan, medications, and routine checks to make your blood sugar less jumpy and your body less stressed. If you've been feeling stuck or like your current plan isn't doing enough, consider digging deeper into these vitamins to see if they might help you reach better control and feel more comfortable day to day. Feel free to share which vitamin you think needs the most attention in your own life, whether it's vitamin D for better insulin action and nerve health, vitamin B12 for energy and sharper thinking, or folate for healthier cells and fewer complications with circulation. If you want more updates on ways to handle diabetes in a smarter, less draining way, subscribing to reliable sources of information can make a difference. There's often new research and fresh strategies for those living with diabetes, and you never know when you might discover a tip or trick that resonates with your situation. Thank you for reading this long guide. Diabetes does not have to keep you trapped in fatigue or frustration. While there is no single cure-all, adjusting your vitamin intake might be an overlooked step that brings you more balance and comfort. By paying close attention to vitamin D, vitamin B12, and folate, you can give your body extra support to face the everyday challenges of diabetes. Here's hoping you find a path that helps you feel more in charge of your health. Take care, and remember that every small change has the potential to make a lasting impact on your well-being.